These are the supplements as an OB-GYN and menopause specialist I take in a day and why. First off, I have creatine. Creatine has been studied in menopausal women who were doing strength training, showing a positive effect on their muscle mass and growth. There's really, really great studies on this. 5 grams a day is what you need. I'm going to put all my powders in here and mix them up. Second is something called Skin and Bone. I developed this one specifically based on 2 separate collagens. One is called Rationale and the other is called Fortibone. So these were studied in randomized controlled, placebo-controlled studies looking at improvement in collagen in the skin and also in bone density on women who were, so in the bone density studies, they already had osteopenia, osteoporosis, and saw improvement in their bone density. These were women of multiple ages seeing improvement in the collagen in the skin, which we lose 30% of in the first 5 years of menopause. So for skin health and bone health. And then turmeric. I don't take this every day. I take this when I'm having aches and pains, like now. So my hip's been bugging me for a couple of days. I probably tweaked something when I was exercising. So the turmeric helps me get my inflammation under control. I have that. This one is the magnesium that I prefer. Why? It has great, your glycinates or tartrates, this is L-threonate, your bisglycinates will absorb well into the bloodstream, okay? Oxide tends to stay mostly in the gut, and chloride is like used to have relieve constipation. Anyway, I like this one because the studies are showing it crosses the blood-brain barrier really well. So I take it in the afternoon to help me with calm and to help me with sleep. And it seems to work pretty well. With the days that I don't eat salmon or tuna or a fatty fish, I will take my omega-3 vitamin D, vitamin K combo. 80% of my patients are deficient in vitamin D. I was deficient in vitamin D, so this helps me maintain my vitamin D levels in a healthy range. And finally, on the days that I don't have yogurt, which is the main source of probiotics in my food, I will take a probiotic supplement. This is one from my friends at Alloy. I pay for this myself. They do not sponsor me to say this. And it is it has some pretty good white papers. There's lots of studies done looking at different probiotics and on women who happen to be menopausal with obesity and hypertension, showing improvements in both. And then finally, this is one of the old labels we used to use when it was still under Galveston diet. This is a fiber. Probably if you had to pick 2 for health benefits that would benefit you the most, your fiber and your vitamin D are going to probably be the 2 top ones. I would pick, the fiber looks like this now with the pretty blue label, but I don't like to waste, so I'm going to finish this guy up. And that is it. None of these cure menopause. None of them. They're not a menopause cure. This is supporting your nutrition, which if you can get all these nutrients through your diet, absolutely, you don't need any to buy any of this stuff. But if you can't, I'm here for you. Welcome to the Pause Life.